During a 60 Minutes interview in 2015, Donald Trump appeared to come out in favor of a form of single-payer health insurance for the uninsured. I wanted to play this clip.
Obamacare is going to be repealed and replaced. Obamacare is a disaster. If you look at what's going on with premiums, where they're up 45, 50, 55%.
So how do you fix it?
There's many different ways, by the way. And everybody's got to be covered. This is an un-Republican thing for me to say, because a lot of times they say, no, the lower 25%, they can't afford private. But
universal health care.
I am going to take care of everybody. I don't care if it costs me votes or not. Everybody's going to be taken care of much better than they're taken care of now.
The uninsured person is going to be taken care of.
They're going to be taken care of.
How?
I would make a deal with existing hospitals to take care of people. And you know what? This is probably...
Make a deal. Who pays for it?
The government's going to pay for it, but we're going to save so much money on the other side. But for the most part, it's going to be a private plan, and people are going to be able to go out and negotiate great plans with lots of different competition, with lots of competitors, with great companies, and they can have their doctors, they can have their plans, they can have everything.
That was Donald Trump in 2015. Dr. Steffi Wohlhandler, can you respond? You're one of the key advocates for Medicare for All. Where does that fit into this picture today? Do you think this is a moment where the time for Medicare for All can be pushed around the country in a very big way as people across the political spectrum are horrified by the specter of, among other things, tens of millions of people losing their health insurance?
Yeah, well, the ACA made some modest improvements to the healthcare system, and the Republicans would pull those all back. But the Affordable Care Act was never a very good bill. It left 28 million Americans completely uninsured, and tens of millions more with these unaffordable gaps in their coverage, like co-payments and deductibles and uncovered services. And that's why the Affordable Care Act has been vulnerable to these Republican attacks, because people look at their own situation and say, even under Obamacare, under the Affordable Care Act, health care is still not affordable to me. So the best way to fight the Republican attacks is to say, let's move forward from the Affordable Care Act to a single-payer system rather than backward through repeal. The single-payer system works because by having a single, simple Medicare for All system, you save so much money on administrative costs and overhead that you can cover all of the uninsured and improve coverage for everybody else who has gaps in their coverage without raising total health care costs. And that's why about 20,000 U.S. physicians have come together into Physicians for a National Health Program to advocate single payer. That's why the National Nurses United, the biggest nursing union in the country, is pushing single payer. It's why Senator Sanders ran on single payer, and it's why Congressman John Conyers has introduced a bill into Congress with 112 co-sponsors for single payer. So now is the time to be saying to the electorate, the ACA was a step forward, but not a big enough step. We need to be moving forward from the ACA to that single-payer Medicare for All plan that Americans need and deserve.
And how feasible do you think this is? I mean, Senator Bernie Sanders has yet to introduce this bill, the type that Conyers already has introduced in the House.
Okay, my understanding is Sanders is planning to introduce a bill over the summer. The Conyers bill has gained a lot of co-sponsors. More than half of all the Democrats in the House of Representatives now co-sponsor the Conyers bill. That's more co-sponsors than any time in history. We're seeing a lot of public support for the idea of single payer. We're seeing a big movement for single payer at the state level in California. Obviously, we're getting a whole lot more discussion of single payer now than we've ever had before.
Let me ask you. Let me ask you very quickly. In California, it's passed the state Senate. It's got to go through the Assembly, and then it has to go to Governor Brown. Do you think that he will sign off on it, unlike what happened in Nevada, where the Republican senator in that case said no to Medicare for All, even though it was passed by the Nevada legislature?
We're only going to get single payer if the populace keeps the pressure on the politicians. It's not going to happen automatically. It's not going to happen because Governor Brown has occasionally in the past said he likes single-payer. It's going to happen because we have a movement that's strong enough to counter the political power of these rich people who are getting these huge tax cuts, of the insurance industry who would have no place in an efficiently run single-payer system, of pharma who thinks that they're going to have to accept lower prices under a single-payer. In fact, they're right. So that's a lot of political power, and the only way to push through that is to really build a movement. But, you know, that really seems possible right now with polls showing that 2 out of every 3 Americans who have an opinion on health care think we need some sort of Medicare-For-All program. So now is really the time to be pushing this, and in fact, the only way to really counter the Republican momentum at this point.
Well, Dr. Steffi Wohlhandler, I want to thank you for being with us, key advocate for Medicare-For-All. And again, when she referred to pharma, meaning big pharma, the drug companies. And Dr. Willie Parker, who happens to be joining us from Aspen, Colorado, who is the chair of the Board of Physicians for Reproductive Health. This is Democracy Now! When we come back, a devastating piece in the latest Harper's Magazine, Ghost Nation. An ethnic cleansing campaign by the government threatens to empty South Sudan. Stay with us.